Hello guys, again in another video in our series of neuroradiology. Today we're going to talk about intracranial hemorrhage. As we know that we have two types of intracranial hemorrhage, the intraaxial hemorrhage and extraaxial hemorrhage. In the intraaxial hemorrhage we have the intraparenchymal hemorrhage and intraventricular hemorrhage, and here we have the subarachnoid hemorrhage. For the extraaxial hemorrhage we have the subdural hematoma and extradural hematoma. Subdural hematoma is an hematoma between the dura and the arachnoid, and extradural hematoma is an hematoma between the skull and the dura. So we're going to talk now about the appearances of hemorrhages on the CT scan. If it is acute, we're going to have the blood white. In the subacute phase, we're going to have it gray. In the chronic phase, the all blood is dark. In the acute on chronic, we have layering effect. Now let's talk about epidural hemorrhage. As we see here, we have epidural hematoma and subdural hematoma, the association of both. Also, we have this midline shift and the slit of ventricles, also the shift of the ventricles to the left side. Now let's talk about this epidural hematoma. Here we have hyperdensity, so we are in the acute phase, and also we have what we call the lens shape. So this lens shape is a synonym of epidural hematoma because we have the skull here, and also we have here the dura. So we have this hematoma between the dura and the skull. So we have this lens shape, and hyperdensity mean we are in the acute phase. So we have epidural hematoma on acute phase. Another case here of epidural hematoma, if we see here, we have this loss of differentiation between the white and gray matter, and also the midline shift and the shift of ventricles. And here we have epidural hematoma in the subacute phase because we have the gray, as we say, in the subacute phase we have the hematoma in gray. Now let's talk about subdural hematoma. As we see here, we have this shape, we call it the crescent shape. Here we are in the acute phase because we have the hyperdensity, and we have what we call the crescent shape. And it's a synonym of subdural hematoma. Also here we have a clear subdural hematoma. It is dark, so we are in the chronic phase. Also we have the midline shift. And here we have a small acute component. It's hyperdense because it's acute. Also here we have subdural hematoma acute on chronic. So we had a chronic subdural hematoma, and here we have this acute phase. So we have this hyperdensity. And note also the crescent shape that we see, crescent shape. So we have subdural hematoma. Now let's talk about subarachnoid hemorrhage. Here we have normal CT scan, and here we have this hyperdensity in the basal cisterns, here, and the quadrigeminal cistern. As we see here, we have this hyperdensity. It's abnormal because normally the quadrigeminal cistern and the suprasellar cistern are dark, but here we have this hyperdensity, and it's a synonym of subarachnoid hemorrhage. Note that subarachnoid hemorrhage can extend also to ventricles and give us intraventricular hemorrhage, and we can see the hyperdensity inside of the ventricles. Now let's finish intracranial hemorrhage with this image. We see a non-contrast CT scan, and here we have this intraparenchymal hemorrhage, and here we have also hyperdensity inside of the ventricles. So we have this hyperdensity here and here, so we have like an extension of the hemorrhage from the intraparenchymal hemorrhage to the ventricles, and we had this intraventricular hematoma.